We know that from several studies that people, when they seek out information themselves about a health issue and then they find it, they are much more likely to trust that information than if a public health authority actually gives them the same information. So that seeking behavior, that sense of control over the process is really critical in helping to establish trust in that information. We know that social media obviously allows us to rapidly share information and health experiences. So not just the cat playing the piano, but okay, this is what it's like to give myself an injection every day, and this is what it's like to go through autism, oral learning treatment with my child. And I'm going to video and upload the process of that over the next few months, and you can watch it if you're a parent with a child newly diagnosed with autism. Presumably, it has the power to empower patients by giving them tools to self-manage. And I'm not going to talk too much in detail about this feature because Alex is going to talk about that more in depth. Presumably, if you have to type in and search about health information, you'll be more informed about your condition or about information related to public health. As in the opening video, information relevant to your own individual health you may not be just finding it out in the future, it might be finding you through matching through social networks and profiles that a sort of online persona that you keep online. If you have certain kinds of behaviors, you may be targeted by certain kinds of advertising or certain kinds of public health messaging, like maybe you should not have that second piece of cake where you're sitting with a GPS-enabled device at a cafe. Anyway, there's an idea that this can help us communicate better and coordinate with diverse experts. A lot of social media platforms have expert fora or experts who participate. So there's an Ask the Expert, and a lot of people are interested in that component. Finally, authority and trust is embedded in the tools that are particular to each type of platform. So people understand or trust is established in each platform in distinct ways. One way that I'm very interested in is virtual witnessing. For example, on YouTube, we all know the power of the anecdote for convincing us that something is a potential harm. Here we go. Here is an example of a YouTube anecdotal stories of harm. Now I should point out that on the other side of the coin, you have a lot of anecdotal stories of harm from meningitis and parents anguished over choosing not to vaccinate and then having their child struck with meningitis. But this is an anecdotal story of harm where a person believes that they lost their arm and their leg because of a flu vaccine. And they've disseminated this and put this on YouTube, and it's a very powerful testimony to their belief in the potential harm of vaccines. Just of note, if you look at the comments and responses, they're largely supportive. And so YouTube, if you see vaccine critical videos on YouTube, it's not surprising that they solicit or elicit a kind of community response from people with similar attitudes and ideas. And to the right, you can see videos that are tagged with similar ideas about vaccine harm. So my point is that the minute you get to one vaccine critical video, you're pulled in to a network of people who think that vaccines are quite harmful. And you're given access to a range of resources that support that. So I'm just going to talk a little bit about 3 social media cases that I've been engaged with since 2007. I chose to work with 3 different platforms, YouTube, MySpace, and Second Life. I won't go over YouTube. YouTube is a video sharing platform, which only a few of you actually use every day. It's something that I use almost continuously. And there are an enormous amount of health-related videos on YouTube. It's fun to explore if you have any time. Here's an example of a traditional public service announcement by a UK clinic on flu vaccine. I should point out that it received it received a very poor star rating and no comments. I'll just put that back up. The MySpace, I don't have a frontispiece of their website, but it's a typical social networking site very similar to Facebook. And I've also engaged in several pilot projects related to health information and knowledge exchange on Second Life. Here is the greeter avatar in Second Life's virtual real estate, in their virtual space on Second Life. And here's my avatar, my research group's avatar, Ella B. Hellendale. who is having a mock mammogram. So our avatar can demystify the mammogram experience in the virtual Ann Myers Medical Center. And on the right, I've tried on a Kaposi sarcoma skin, which you can wear to parties and dancing, which is a very popular activity on Second Life, and experience the sort of social marginalization of being dressed very provocatively and wearing a sarcoma skin. The context of this research, for those of you who haven't paid any attention to vaccine criticism, is that I did these social media research projects in an era, since 1998, of heightened concern about childhood immunization. Here's a typical vaccine-critical website saying, love them, protect them, never inject them. For those of you who aren't familiar with Jenny McCarthy's autism campaign, she believes firmly that her child's autism was caused by immunization, has been very influential in frightening parents about the safety of immunization. Studies, there's many studies, some of them are my own, that have shown that the quality of information about immunization on the World Wide Web is very varied, and that vaccine critics often rank much more highly on search engines, so you get to their information often first. And just to summarize our findings, in all three platforms, in our virtual world, our social networks, and on YouTube, we found a very strong presence of vaccine critics. For example, on YouTube, we found... Oh, here's Jenny McCarthy. So we found, for example, on YouTube, well, there were about 40-40-20 negative, positive, ambivalent videos about immunization. So about 50-50 were positive, that took a strong stance about the safety of immunization. 50% were positive, 50% were negative. The negative videos had far higher viewer ratings and comments, suggesting that the people watching them certainly resonated more with the videos than the positive videos. And unfortunately, the standard traditional public service announcements rated the lowest and got the poorest user feedback. So, just to summarize, as a researcher engaged in doing social media research, we've encountered, my research group, we've encountered some challenges beyond trying to buy virtual real estate in Second Life using CIHR money. It's very challenging to create virtual furniture and holding virtual focus groups and paying for virtual objects. Some of the other challenges that we have is the academic cycle of publication makes it really challenging when there's a rapid evolution of these social media platforms. And so a study that I did 3 years ago is probably just coming out now. And in many cases, the platform has already transformed, or the demographics have transformed. One good example is MySpace. MySpace is already being surpassed by Facebook at the time I published my MySpace study. Another challenge that I find is that in trying to give advice to public health communicators, it's extremely difficult to articulate what the objectives are with engaging with social media. Is it to break into or steer existing health conversations using these different platforms? When I'm doing research studies trying to evaluate or trying to assess behavior on these sites, it's challenging for me to use traditional sampling techniques and to use representative samples. One strategy we're moving towards is using network samples, and I can talk about that in the Q&A. Some other problems we've encountered are doing social media research, getting ethics approval with a proprietary environment, forming appropriate research collaborations with people outside of public health, outside of health communication, people with the technical expertise and knowledge. And then Alex is going to talk more to this, so I'm just going to conclude. But one of the biggest challenges that we found is how we can actually evaluate these social media campaigns related to public health. And so we're trying to develop frameworks and means to assess this. Thank you.
Thank you so much.